The fourth biennial conference on medical products regulation in Africa took place in Victoria Falls under the theme A Decade of Regulatory Harmonization in Africa, with special focus on strides that have been made and the targets set to achieve the organization's goals. The first conference was held 6 years ago in South Africa, with successive events every 2 years in Ethiopia, Ghana, before this year in Zimbabwe. A platform created for all the stakeholders to come together and discuss issues of common interest. This year's event was unique in that it also fed into the various Continental Technical Working Committee groups, the African Medical Regulators Conference.
Welcome to such a beautiful part of the world. I do hope that you're able to get out and explore some of this. I've been here for a couple days now, and you know you're not from here when you just find a trail and you start running down it, and then you start seeing elephant scat and other things and animals running with you, and it's like, I am clearly not in Seattle, Washington anymore, but welcome to such a beautiful part of the world.
Chairperson of the organizing committee, Margaret Ndomondo Sikonda from the African Union Development Agency, NEPAD, kicked off the event with her keynote address that pinpoints the aspirations of the continent.
We have development agenda for the continent, and for us in the continent we are subscribing to Agenda 2063 that speaks to the aspirations of what Africa wants to be in the course of 50 years. And of course, I just highlighted a few goals of the Agenda 2063, and this is goal number 1 and 3. One speaks to aspiring to have a high standard of living, quality of life, and well-being for all citizens. And number 3, actually, that one is not 2, is number 3, to have healthy and well-nourished citizen.
Zimbabwe Minister of Health Dr. Obadiah Moyo officially opened the conference with his welcome speech to the delegates. Impressed by the numbers in attendance, Minister Moyo said the big turnout was indeed a demonstration of the conference's significance.
We are, as Zimbabwe, honored to be hosting the fourth SCoMRA, and whose theme I said is a decade of regulatory harmonization in Africa. To our eminent speakers and delegates who have come from all over the world, I welcome you very warmly to Zimbabwe. We have about 300 participants from our sister countries, from the Africa continent, gathered here today, making our conference a truly international one.
Dr. Moyo was emphatic about the need to emerge from the conference with solid action plans that would enable the implementation of resolutions.
We don't want to create, like I say, talk shops. We want reality. We want to be able to achieve results. And it is very well known that the African continent has a high burden of disease. For example, the HIV/AIDS, malaria and tuberculosis, and the prevalence of non-communicable diseases is on the rise. And despite this, many of the regulatory authorities for medical products on the African continent are under-resourced, leading to long delays before medical products become available to the population. And the continent is also faced with the threat of substandard and falsified medicines due to weak regulatory systems. It is therefore important to build capacity for medicine regulation in Africa.
In a speech read on his behalf, World Health Organization representative to Zimbabwe, Alex Gasasira, emphasized the need for introspection through discussion of challenges faced in the past 10 years. Likewise, it was important to come up with recommendations as guidelines to the next decade.
My understanding is that the objective of this scientific conference is to stimulate discussion on progress made in the past 10 years on regulatory harmonization and alignment of regulatory systems and networks, This conference will also identify regulatory challenges facing Africa and provide an opportunity to share lessons learned in our respective countries, and should end with proposing a way forward in the next decade, but with a special focus on the new African Medicines Agency.
Gasasira challenged the participants of the conference to apply themselves in keeping with the recent resolutions of the 74th United Nations General Assembly.
However, this conference is being challenged to create an important link to the commitments that were agreed upon by our respective heads of states at the recent 74th UN General Assembly, where the Honorable Minister is coming from, where the main goal was to strengthen regulatory systems to enhance health systems performance for accelerating progress towards universal health coverage. These efforts will be measured by their ability to promote increased access to affordable, safe, effective and quality essential medicines, vaccines, diagnostics and health technologies that ensure quality services and prevent harm to patients and health workers.
The welcome remarks having been done, it was time to get on with the real business of the conference. Addressing delegates with a key message on the purpose of the Regulatory Systems Strengthening Program was Geneva-based World Health Organization Coordinator, Team Leader Regulatory Systems Strengthening, Dr. Mike Ward.
So, what is the Regulatory System Strengthening Program all about? Well, really it has two basic goals. It's to build the capacity in member states consistent with good regulatory practices. And when I say good regulatory practices, it's not just building capacity, getting more resources, it's how we do our business, because no regulatory authority in the world has enough resources to undertake their mandate.
Capabilities to do regulatory ethical ability is very low and is only existent in a few countries. South Africa, I think, has a number of them, Egypt to the north, and here and there. But that is not enough.
It was important to integrate the contributions from the floor as well as interrogate grey areas, and as such there was an open session where delegates were allowed to throw questions from the floor. On the sidelines of the conference, different delegates spelled out the importance of the conference, pointing out its relevance in charting the way forward. Mark Jean Kaira of the Gambia welcomed the conference as integrating different economic zones of the continent whilst bringing key partners to come and share ideas.
Conference brings all the different 8 regions, the SADC, the Oceanic, the different regulatory regional initiatives all around Africa, and this scientific conference brings all of us in Africa together, also including our partners, our stakeholders that we are always working with. Example, the Bill and Melinda Gates Foundation, the WHO, etc.
South African-based Clinton Rambanepasi said the conference would facilitate the expedition of making medicines available to the patients.
The conference is important because it's facilitating faster access of life-saving medicines to the patients. It allows to have one patient, one product, and one regulatory standard through the harmonization of requirements if you want to market and register medicine.
I think it's a very important conference for getting all the regulators of the African countries and beyond at one table so that they are able to discuss. And for now it's also important not able to discuss on how to best progress, but also for now to bring everyone on the same page on where we are.
G. Njimbon, who came all the way from Paris, France, called out for more conferences than just once in 2 years, pointing out that there was so much work to be done. As a result, he had been so absorbed with the deliberations at the conference, he had not managed to steal a moment and even experience the falls.
It's a great event. The only thing is only every 2 years, but I can understand because there is so many work to do in between, right? So it's a great event, well organized, fantastic place. Unfortunately, I still haven't visited Victoria Falls because I'm so involved in what's going on here that's the only concern. I wish I would have the time to discover the region, the area, right?
With all done and dusted, the conference came to its close, but what was fundamental was the need to transform talk into action.
And finally, this is all about smart regulation and contributing to access and public health. Thank you.